Good morning. This is the bilingualism of rehabilitation process. Then, HIV. The viruses that cause HIV infections are retroviruses, which are RNA viruses that are replicated by intermediate DNA, which depends on DNA polymerase or retrotranscriptase, which comes from RNA and is found inside the barrier. This enzymatic set allows copying or transcribing genetic information from RNA to DNA. This process to synthesize a particle from genetic information in the form of RNA is only attributable to these viruses. HIV means human immunodeficiency virus. It damages the immune system by destroying the white blood cells that fight infection. This puts you at risk for serious infection and certain cancers. It is usually spread out and protect sex with an infected person. It can also be spread by exchanging needles to inject drugs or by contact with the blood of an infected person. And women can infect their babies during pregnancy or childbirth.
Diagnostic. The definitive diagnostic of HIV infection can only be established by laboratory methods. Signs in one case are the clinical manifestation specific now. Direct methods detect the virus itself or one of its components, shows proteins or nucleic acids, while the indirect ones recognize the specific antibodies produced by the immune system in response to viral infections. Among the indirect methods we find screening serological tests, ELISA, agglutination, blood, and immunochromatography tests. This is a laboratory test commonly used to detect antibodies in the blood, and confirmation tests Western blot. Within the direct methods are two: viral culture, antigemia detection, molecular detection of proviral DNA, and viral RNA.
Finally, the treatment of this type of patients is according to the Ministry of Health. They proposed a management of HIV/AIDS based on scientific evidence in Colombia. Initial interventions are: first, disease education, mode of transmission, real risks for loved one, general dietary recommendations, self-care precautions relevant to the prevention of opportunistic infections, efficacy of antiretroviral therapy, and requirements for success with therapy. Second, advice about lifestyle such as sexual behavior, alcohol or drug use, and smoking. Third, hepatitis B vaccine. Fourth, influenza vaccine. And fifth, Streptococcus pneumonia vaccine. Antiretroviral therapy. Antiretroviral therapy shall be done consisting of a mixture of 3 drugs and shall be done before the risk of disease progression is imminent. Follow-up of infected patient. One must always be attentive to the signs or symptoms that present the patient and suggest the progress of the disease. Candidiasis, chronic diarrhea, frequent herpetic infections, weird infections, or opportunistic tumors. Inquiry into compliance with treatment, nutritional status, mood, drug and alcohol use, and social environment.